everyone. I am Dr. Bhushan Rathod, Consulting Orthopedic Trauma and Joint Replacement Surgeon, practicing in Bandra, Mumbai. Today, I would like to get your focus onto an important thing that could affect us at any point of time in our life, that is bone fractures. I would like to tell you about what are the do's and don'ts that you are supposed to do in case you sustain from a fracture. A bony fracture could be secondary to an accident or a sports injury or any other haphazard. A bone fracture is extremely painful and has to be handled with extreme care. So what are the do's? The first thing that you're supposed to do after an bony injury or fracture is to get immediate medical attention. I will tell you what you're supposed to do in the time being till you get the medical attention. First thing you're supposed to do is try and immobilize the affected part. By immobilization, I mean try and restrict further movements of the affected part. That can be done with the help of a splint or an arm pouch or a makeshift splint. A makeshift splint could be as easy as a folded sheet of newspaper. What immobilization does? It prevents further bony movements, and that could prevent any further neurovascular damage. Second thing that you're supposed to do till you reach a healthcare facility is that apply ice packs or cold packs. What ice packs and cold packs are going to do is that they are going to decrease the pain and inflammation. Thirdly, when you reach the healthcare facility, the type of treatment that could be provided to you, depending upon the type of fracture by your surgeon, could be a normal splint or a cast or a surgery. You are supposed to follow all the instructions given by your surgeon and follow up with him on a routine basis. What are the don'ts that you are supposed to do? First thing that you're not supposed to do, that is done by most amount of people, is that you're not supposed to massage the affected part, because massaging is going to further increase the inflammation. Secondly, what you're not supposed to do is that you're not supposed to put any amount of weight on the affected limb. Third thing that you're not supposed to do, sometimes after a fracture there is a visible bony deformity. You're not supposed to try and realign. Realign means try to correct the bony deformity on your own, because in trying to do that you're going to cause more damage than betterment to you. The last thing that you're not supposed to do is that you're not supposed to move your hand or the affected part beyond a certain limit. You're supposed to restrict the movement. You're also supposed to, in case of a long-standing fracture, you're also supposed to look for signs of infection. That could be any local raise of temperature around the fracture site, any redness or any discharge coming from the fracture site is suggestive of an infection. I would also like to emphasize on the fact that recovery process is different from patient to patient. Usually it takes 4 to 6 weeks for the bone to heal. You should follow a good balanced diet that could help in your bone healing at a faster rate. The second point and the second topic I would like to discuss today is what could be the rehabilitation protocol, or what should be the ideal line of management after any kind of knee surgery. The knee surgery could be a joint replacement surgery. It could either be an ACL reconstruction ligament injury or a meniscus injury. The first thing that you are supposed to do that is done at the time of discharge is you are given a fixed set of post-operative instructions that you're supposed to follow routinely and religiously. The second thing that you're supposed to do is that you're not supposed to put excessive limb or do any impact exercises that is going to put an excess of weight on the affected knee. Thirdly, you're supposed to take due rest. Fourthly, you're supposed to follow the type of wound care protocol and the physical therapy protocol given to you, especially after a joint replacement or a meniscus or a ligament injury. Physical rehabilitation protocol plays a very important and a vital role. Lastly, you are supposed to maintain a good and healthy diet. You are supposed to refrain from smoking, and while being mobilized in your physical therapy, you could use supporting measures like a walker or a stick or a brace that could help in reducing excess of weight or strain on the affected knee. The recovery protocol will vary from patient to patient. You should consult your orthopedic surgeon on a routine basis and follow up with him on a routine basis. Thank you.